So because Sergey is a Animal Connections dog that is being fostered by one of our receptionists, he is not getting an IV catheter. So he is getting ketamine 0.5 mLs and diazepine 0.5 mLs IV just injected directly into the vein. So I am doing that, and then once he is out enough, I am going to use a 6.5 ET tube, and then he will be hooked up to isoflurane. The procedure he will be getting today is a neuter. He also ended up having 2 adenomas removed, one from his right hind on the dorsal aspect, and one from his left front on the second digit distal phalanx, which were removed with a laser, with a CO2 laser. Obviously this was not a part of the surgical nursing video, but since I was the one who intubated him and knocked him down, I just figured I would go ahead and put it in the video anyhow. Here we're applying iLube. Next, we will get him properly put on a table, centered on, still on the heat source, which is a hot water blanket with a towel over top so he doesn't get burned. So he will be tied in and then hooked up to the monitor. Here I'm hooking the leads up to the monitor while the other assistant ties him in to the table. Once the leads are in the proper position, I will squirt alcohol in them for proper conductivity. Next I will start shaving. As you will see, I go to get the clippers, and someone had used them and taken the blades off right before surgery, which I had already set up for, so I just went and grabbed a clean set of blades. You'll see I'm also shaving his right hind dorsal for removal of adenoma Then the owner, who is our receptionist, also decided she wanted the one on his left front also removed. But that was when the surgery had already started. So the last part of the surgery, we will also shave the left front after the neuter and removal of the one on the dorsal right hind has been taken off. After shaving the proper areas, I then do a non-sterile scrub. I will then come back later and do a sterile scrub. The reason I shaved the neuter site first and scrubbed and then moved to the foot was because our clippers tend to get hot and he has sensitive skin from having Demodex and other skin issues such as yeast infections. So his skin is very sensitive, so instead of tearing up his skin and giving him razor burn, I tended to break it up. This also gave the Chlorhex more time to sit with contact time, and then I can go back with our sterile scrub after I'm done shaving the foot. Here I'm putting on a sterile glove to do the mock sterile scrub. Ideally, the 4x4 should be in a boat with sterile gauze. We do not do that at my practice, so I just put on a glove for the video to kind of do a mock sterile scrub. Next, I'm going to tie in Dr. McGill. Usually we only do the top straps in our gowns. So that's what she initially asked for, and then this one was a little bit baggy on her, so then she ended up wanting the bottom one done as well. Now that the dog is prepped and the doctor's ready to go, I'm going to start opening for packs. The first pack to be opened, after checking the package to make sure it was properly sterilized, is a cover for our Mayo stand, which we use a small drape. Since it's just a neuter, we use a small laceration pack, which just has the basics, such as gauze, a few Kellys, needle holder, some tissue forceps. Next will be towels. This actually pack was wrapped incorrect, and it should have had 4 small towels, and instead it only had 2. So next, later, she'll ask for 2 more towels. Here I'm repositioning the patient and putting the light in the correct spot for the neuter.